Greetings, everyone, and welcome to what we're calling the Extra Life Conversations. I'm Stephen Johnson, co-host of the Extra Life series and author of the book. We hope you've had a chance to watch episode 4 of the series on the importance of behavior change in extending our lives and combating threats like the COVID pandemic. If you haven't seen it, the series is streaming at pbs.org and on the BBC iPlayer. I want to start by thanking the CDC Foundation for helping us put these virtual events together. I'll have more to say about them at the end. And also thanks to the publisher of the book, Riverhead Books, and the Pulitzer Center, which is developing curriculum materials for teaching this epic story of our extended life. We're using these conversations to explore additional avenues that we didn't get an opportunity to do in the TV series. And given that episode 4 is the final episode of season 1 of Extra Life, we wanted to use these conversations to look back both on the behavior episode, particularly in the light of the COVID crisis that we've all been living through, but also we wanted to take the opportunity to reflect on the big picture story of life expectancy and its extension over the past few centuries, and speculate a little bit on where this critical trend is going to take us over the coming decades. So to explore these themes, we have 2 fantastic guests joining us. First up, we have Dr. Tara Smith, who's a professor of epidemiology at Kent State University College of Public Health. Dr. Smith's research focuses on zoonotic infections which are transferred between animals and humans, of which the coronavirus is likely one. She was the first to identify livestock-associated strains of the resistant superbug Staphylococcus aureus, MRSA, a little bit of which we discussed in a previous conversation. And she's pioneered the investigation of this in the United States. She's well known for her public engagement. She writes a regular column for Self, is active on Twitter, where she tweets on things like vaccine hesitancy and government policy. After my conversation with Tara, I'll be speaking with Dr. Max Roser, who's the director of the Oxford Martin Program on Global Development. And there he studies the history and future of living conditions around the world. Max believes that to make progress against important problems, we need access to understandable research and data. To this end, he's the founder and editor of Our World in Data, which is an open access and open source online publication which has millions of readers every month and is even used by policymakers. Both Dr. Smith and Roser were advisors to the Extra Life television series, so it's particularly fitting to have them here in this final conversation. So, Dr. Tara Smith, you're first up. Thank you so much for joining us, and thank you for all your help with the series over this past year.
Absolutely. Thanks for having me on.
So, starting with this behavior episode, there's a line near the beginning of it where, in my conversation with David, my co-host, I say something like that the COVID crisis was probably the single biggest coordinated global change in behavior in a short amount of time that we've ever seen in our history. I mean, even world wars took longer times to develop and required less behavior change for people, not on the front lines. So there's part of me that looks back on that and thinks that despite all the needless resistance and the polarization, which we'll talk about, that it's kind of amazing on some level that we were able to, so many of us were able to do this, and we're willing to reorganize our lives to reduce the threat. Looking back over this past year, do you share that feeling, or what are your thoughts on that kind of perspective?
Yeah, I do. It's looking back. The first time I came back into my academic office, after we shut down, was many months after shutdown, and on my desk I had a list of things to do and things to discuss with the university about the possibility of a pandemic. And I should have been a fortune teller or something, because there's all these things, talking about masks, talking about travel. What are we going to do with online courses? All these things that, of course, had happened since then. So it was amazing what we did in such a short period of time. I mean, moving to online classes for almost everyone, at least initially, wearing masks, changing our behavior around other individuals, not seeing people who are unmasked, doing social distancing. I mean, it is amazing what we have done in the past year to try to control spread of this virus, even though it has been tiring, it has been exhausting, it has, cost jobs and, really fundamentally changed some things for lots of people, especially women who have had to kind of pick up some of this slack. I think it is really impressive what we have come together to do over the past year or so.
Yeah. It's funny. It's a little bit like you're having those notes on your desk is a little bit like when we were putting this show together in, January, and we were like, we have a big show that starts off with a whole series about mass vaccination efforts. And all of a sudden, well, wait, this turns out to be kind of newsworthy in a way that we didn't necessarily want it to be, but it turned out to be. I think, one of the things that's been wonderful watching we talked very early on in the pandemic for the Fighting Coronavirus podcast that I was doing at the time. That's how we got you involved in advising us on the show. And, one of the things that has been clear, and I think is becoming increasingly clear to me looking through the history of past public health crises, not just pandemics, but the wider scope of events that we've had to deal with in the past, that there's a really important role for kind of the translators who are out there, public figures who are making sense of the science or explaining the risks, which is, so much of this is risk analysis. And, you have scientists, and then sometimes those scientists are also the kind of explainers, and sometimes they're separate people. I think, you've played a wonderful role from the beginning in this, in things that you've written, and your presence on social media and interviews you've done. Is that a role that you prepared for? Did you know that would be something you would be doing if a global pandemic emerged? Did you have training for that, or was it just something you stepped into?
Yeah, it's definitely stepped into. I don't think, even the people who have studied pandemics and work on biopreparedness, I think that's still a different role than translating all of that for the public, because usually you're doing it for funders or policymakers or something like that who already have some idea of the language and the background. So this is definitely not something I ever really planned on and really have kind of stumbled into along the way. I've written a science blog since, about 2002 that initially focused on evolutionary biology with a group blog called The Panda's Thumb. And then I spun off my own blog about a year after that when I realized there was a lot of things I wanted to talk about that weren't necessarily evolutionary biology. So I've been doing this almost for 20 years, amazingly. And along that time, we've had lots of outbreaks. So the first one I really dealt with and really wrote about was we had a large mumps outbreak in Iowa in the mid-2000s that spread from Iowa to other surrounding states, mostly in college students. So I talked about, the vaccine and other aspects around that. And then we had the threat of avian influenza for many years, still out there, that I wrote about quite a bit. And then, of course, the 2009 influenza pandemic, and then Ebola, and then Zika, and all of these things that have just come up repeatedly that require a lot of the same type of explanations. So unfortunately, I was able to have a lot of training from past outbreaks that has really played a role, I think, in responding to this one.
Do you remember, having been so involved in writing about and thinking about and looking at those early patterns in those previous outbreaks, do you remember the point with COVID where you thought this one is going to be different? Is there a kind of memory of that?
Yeah, I think late January, early on, the messaging we were getting out of China was that this was not transmissible human to human. So initially, even before they announced that it was a coronavirus, I thought that this might just be another avian influenza outbreak, because that's usually what we see with those, is that they can be explosive, they can cause cases in people, they can cause deaths, but they don't really spread person to person. So, then when they announced that it was a coronavirus, well, that caused a little bit more concern, because those have been transmissible human to humans, and of course caused SARS early in the, past early 2000s. And then when they announced that it was spreading person to person, and then they shut down Wuhan, that was, I think, the first real big oh no, this is has the potential to be really bad. Even before Italy, before New York, just what was happening in China really concerned me.
I think we will. We know some version of this will happen again, and that moment, I think, when a whole major city is effectively shut down, wherever it is, the world will really pay attention much earlier, I think, than people will take it more seriously. Not just people in the epidemiology community, and public health community, but the whole world will pay attention. So that at least will be maybe better prepared in that sense. So we talked a little bit about the positive side of this. The negative side is obviously the extent to which the response to the pandemic in terms of behavior change got wrapped up in politics and the kind of polarized landscape that we live in the United States, at least. Is that something that people saw coming? I mean, I want to talk about vaccine hesitancy and all of that, but we knew that was going to be a problem. But did we expect that something like mask wearing would be divided along political lines the way it ended up being?
Yeah, I think not as much. I mean, so there was, in previous pandemics, in 1918, there were anti-mask groups. So we had seen this before, but they were pretty small and pretty fringe and didn't really have a lot of influence. So I think we had anticipated this, but not to the level that we have seen it happen in 2020 and 2021. That you have so much backlash and even some violence that we've seen around the country. I don't think we anticipated that for something as simple as mask wearing.
It's interesting. I mean, I think we maybe even talked about this, I can't remember, in our original conversation, but it's not inevitable, it seems to me, that mask wearing would have been seen as a liberal kind of intervention in a way, because it's something that you do individually. And if you carry a gun to protect yourself as part of your individual liberty, you could have spun it, I suppose, as kind of like, and also I wear a mask as part of my individual. The state can do whatever they want with their vaccine campaigns, but I'm taking matters into my own hand with a mask, and that could have been theoretically compatible with a more libertarian political worldview, but unfortunately, that message didn't come from the top, I guess, is the problem. It's a strange one. Yeah.
I think when you had, kind of the biggest representative of kind of that side of the political spectrum speaking out against masks, not wearing them, and, talking about, that the virus really wasn't that bad, I think that was when it kind of started to go downhill and started to really have that division, unfortunately. And then when mandates hit, I think that also played into it. Again, when the government was telling you what to do, then that kind of solidified, I think, some of the resistance. Yeah.
So what's your sense of the vaccine rollout? Look, we know, and we've discussed this on both the show and in these conversations, that the development of the vaccines and getting to functional, amazingly efficacious vaccines in less than a year is an all-time science and medicine triumph. It will be in the history books, right up there with the original smallpox vaccine. So A+ on that. In terms of getting shots in the arm, as it were, and our concerns about hesitancy and or outright resistance, how do you think it's going?
Yeah, obviously it's mixed. So like everything else in this pandemic, I think Ed Yong described it early on as, kind of a checkerboard. And I think we're seeing that. So in some areas of the country, it has been great. Some areas are almost hitting 70% of the adult population that has been vaccinated. Other areas are, lingering 30 to 40%. So not surprisingly, it has been not uniform across the country. And, I think right now we're starting to hit that wall with people who are either hesitant. So they're either have concerns about the vaccine, they outright don't want the vaccine, they're waiting for others to get it first. For whatever reasons, they're just not vaccinated yet. So we have that population who are actively kind of avoiding vaccination. But we still have access issues in this country. So some people think that's over because the vaccine is available for everyone. So there are no restrictions anymore as far as age for adults, but not everyone is able to go get it. So, there are childcare issues, there are job issues where you can't take a sick day if you have a bad reaction to the vaccine, or you can't take half a day off work to go travel to get it. You're homebound, you don't have childcare, lots of reasons why we still have access issues. So I think we need to think about those alongside of the hesitancy aspect, because both play a role in people not being vaccinated right now. So I know that some places have plans for both of those. So, going door to door in some places to get people vaccinated that have access issues, bringing it into workplaces, bringing it into community centers, those types of things for people who want the vaccine but haven't been able to get it. And then other sometimes creative ways to reduce some of the hesitancy or some of the apathy maybe around some people who haven't been vaccinated yet but could be. So Ohio is having a lottery. The first name was actually drawn yesterday, May 24th, and will be announced May 26th. So it looks like that seems to be...
is it working? Did they have an uptick?
They're telling us they are. So I haven't seen the raw numbers, but they're telling us, percentages of adults getting vaccinated are increasing. So it's a little bit complicated because it came out at the same time that 12 to 15-year-olds could get vaccinated. So we saw a big jump in vaccines. Part of that was due to that age group, but they say that it has increased also in, adults 18 plus, even into some of the older age groups, 70, 80 plus have increased where before the rate of vaccination had decreased. So I'm really hopeful. I mean, it's a big investment, and I hope it pays off.
Yeah, it's like the bars that are offering a shot and a shot where you get a vaccination and a shot of whiskey or whatever. It's like, okay, we're going to temporarily encourage this actual public health problem of alcohol addiction or gambling in order to deal with the problem that we have to really deal with. That's the trade-off. Your point about access is really important, and it may explain something that I've been a little bit confused about, which is that it has seemed to me that the average daily death count in the U.S. has not dropped as quickly as I thought it was going to, given how much of the age demographic that is most vulnerable to, has the highest mortality risk. They're vaccinated in the, whatever it is, above 70%. So I was thinking 2 months ago, I was said, the death rate is going to, drop dramatically because the people most at risk are getting vaccinated right up front. And it hasn't, it's dropped a lot, and we're in a much better place than we were, but it hasn't dropped as quickly as the cases actually have. And I guess the answer to that is that while the age demographic has been vaccinated very impressively, the other demographic groups that are most at risk, like communities of color, African Americans, for instance, have not been vaccinated at that rate. And so that's why you're seeing the death rate not plateau, but not decline as quickly as possible. Do you think is that the explanation that makes sense?
I do. I think that's at least playing a role. That might not be the sole explanation, but that's definitely driving some of this. And there was a publication out just a few days ago looking at least not necessarily deaths, but at least case incidents in the unvaccinated. And so it was showing that in that group, infection rates really had not decreased, which I guess is not too surprising, that those are still the ones out there driving infections. And so even if you have a relatively small number of unvaccinated individuals who are in that high risk group, if you still have the same number of them who are getting infected, then you'll still see a lot of deaths, unfortunately, for a while.
Yeah. What's your take on a phrase that a lot of people have been using, which is pandemic fatigue, where we just hit a wall of like, I know I need to do this, I know I need to wear the mask, I know I need, but I'm done. Is that, how do we keep people, it's like, it's the last mile here, folks. Hopefully just hang in there. Help is on the way. Is there any lessons there that you can give us?
Yeah, and I don't think there's much out there besides you just need to keep going. And we need, I think in future campaigns like this, we have to have something that gives more, that looks better at mental health aspects of this. So it's one thing, just to do, to do the distancing, to do the mask wearing, all of those things, because we know that it will protect you, protect others. But eventually people do get tired of it, and it starts to be a drain on some people's, well-being. And I think that's one thing that we haven't really addressed here well, and something that I think has really, has harmed some people. I don't think it's worse than the pandemic, but I think it is kind of a second aspect of the pandemic response that we hadn't really anticipated as much. So I think there are lessons to be learned from, looking maybe at HIV, that pandemic, and kind of some of the people who were most affected, and the changes they had to really make long term in their lifestyles that we could draw on for this, and draw on from our experiences over the past year to put that into place for the next outbreak like this. But I don't think we were prepared for that.
Yeah, that's one of my favorite sequences in the behavior episode, is that conversation with Richard about the invention of safe sex. Is such a powerful story, and it's such a bottom-up story of the solutions coming from the community itself. It's a great model. I also think it's incentivizing people. I mean, I feel like the messaging has really changed in a nice way, over the last month, I would say, where we're hearing so much more from our public health authorities about what you can do if you get vaccinated. This is there is a get out of jail card here, and all you got to do is get 2 shots, and you're so many things. You're not going to be totally back to normal, but so many things you will be able to do, and I think that helps too with the fatigue. Knowing that it's soon that actually just seeing that things are changing. I mean, I felt I live in New York, and we had pretty much 100% masking out on the sidewalks and even in the parks and things like that, 2 or 3 months ago. And I was kind of like, what, I'm not sure the science really fully supports this, that you can get, just by walking somebody on the sidewalk. And so seeing the outdoor masking kind of pull back, particularly for vaccinated people, seems like, that felt very liberating. Like, oh my gosh, I can spend my time outdoors not wearing a mask. It's very nice. Do you think there are other, in terms of the polarization issues, like, are there better messengers? Are there other kinds of people who should have been invoked in this? Who can talk this language?
Yeah, I think there should have been some from the beginning. I mean, public health people, we were on the front lines, and, especially in some small towns or things like that, you grew up with those messengers. They went to your high school, your kids go to school together. But even in that case, it still, I think, became kind of politicized, and you saw a lot of, again, pushback against public health people, even those that they've known for their whole life. So I think we needed more buy-in from, religious leaders. I think there were some out there doing some of this work, but especially in evangelical circles, I think it was few and far between. So I think we needed some more of those to talk about the importance of masking, love thy neighbor, vaccinate for that reason, protect your community, that I don't think either were out there doing that work, or at least they didn't get enough publicity, or, kind of sharing that work with others. So I think there's, some of those that could have been drawn into this. Other types of community leaders, again, we went mostly with public health people and politicians. And while those may have influence, they're not always the most popular or trusted messengers in their communities, which is really key. So, I think, again, looking toward the future, we need to identify people like that in advance, people who are well-liked in their community, trusted by, wide swaths of the population, and really bring those into this planning process to try to be ready for the next big outbreak.
I think that's an incredibly important point. I hadn't thought about that at all. It's the work that has to be done in the healthy times. Having those sessions where it's like, hey, if something comes up, we'll need your support, and this is why it's important. And I think you're right that it is. Again, it's like masks and libertarian political values. It is certainly compatible with religious compassion, and so much of this is about the kind of your moral circle of concern, right? Are you concerned just with your immediate family, or are you concerned with the community, potentially people you might not meet? And reducing transmission is often about, particularly if you're young and healthy with this particular virus, it's about, stopping a chain of transmission that might end up killing someone you'll never know, but that you should care about because you're a moral person in a community. And a religious leader could be a wonderful messenger for that kind of idea. So let's do that. I think that's okay. So last question. The internet. On one hand, again, it's where we started. Like, there have been so many amazing conversations and incredible works of journalism and uses of Twitter. You've been fantastic on Twitter. We met through the podcast that I did. These conversations we're trying to do. So there is a lot of very, I'm not. My own work aside, there's a lot of high quality, important, science-informed information out there. But obviously there's a lot of misinformation and maybe even disinformation that is, deliberately trying to muddy the waters. How I feel like it's an interesting thing in the sense that to be a public health expert now and a public figure in public health, you almost have to be a media theorist at this point to understand how these channels of information work. I know this is a huge question, but do you have any thoughts on how we reduce the level of misinformation out there?
Yeah, and it's hard. So at the individual level, anyone can go out there and share good information. And, the people who will listen to you tend to be those who are in your close social circles. So when I do presentations on this, I encourage people to get out there and share good information. It won't be perfect. It won't overwhelm all the disinformation, but at least, the people that you interact with the most will, look at you as an individual that if you're in their social circle, they probably know you, trust you, at least somewhat. So, they can look at that information and if it's different than what they've been getting elsewhere, maybe they'll start to wonder why. So that's one way I think we can help with this, but the other has to be done by the tech companies. And I am not a media theorist, but I follow people who study this issue, and there's no simple solution. And what seems to work is something that a lot of people don't like, which I understand, but it's really deplatforming individuals like this. So there's the Center for Countering Digital Hate put together a list looking at the people who had the most shares and the most influence in social media spaces, and they put together a list of 12 individuals who had spread the most misinformation on COVID, to kind of target them with social media companies to be removed from their platforms, and some of them have been. And so I think that's a way to stop some of that misinformation at its source, because then those get, those stories trickle down from those 12 into other groups, and then eventually into other individuals that share it in their, their parenting groups or their neighborhood groups or things like that. So stopping them at the source, I think, is what works, but it's really hard to get people to buy into that, because everyone likes, free availability of information, and it's tricky to try to say, try to define disinformation or misinformation and who gets to control that.
Well, Dr. Tara Smith, you have been a great source of information, positive information, science-informed information in this conversation and all year long. So we thank you for that, and thank you for joining us today. Next up, we've got Oxford's Max Roser to help us understand the long view of human life expectancy. Max Roser, thank you so much for joining us for these extra life conversations. You are the perfect guest to close out these conversations after the final episode of the show. There's a kind of lovely symmetry, because you were involved in this project from the very beginning. I think I was emailing you about it, more than 4 years ago, probably. I personally have always been such a fan of your work, the work that you do at Our World in Data, and we share this kind of intellectual interest, but also I think an interest that's all about change in the world and affecting change in looking at this kind of long-term data, whether it's life expectancy or anything else. And you've become, a major source. The organization you've built up, the resources you've put online have become a major source for looking at the world this way, looking at the world in data. And I guess I just wanted to start with, why is that so important? What does it enable us to see and understand that we wouldn't without that kind of resource?
one of the things that we can really understand by taking this long-term perspective is just how quickly the world is changing. I think that's something that's very easy to miss if we only look at the newspaper headlines and live from the day to day. If you zoom out a little bit, just a decade, but even more so if you zoom out a century or two, then it becomes really obvious just how quickly the world is changing and can change. And I think that's important to understand the present. I mean, it's basically your title, the how we get to now question. Really, that's at the core of this interest. That if we want to understand our current situation, why we have these large inequalities in the world, but also the future, how we can solve the problems that we are currently facing, then this long-term perspective about how the world has changed can really inform us about what's possible there.
Yeah, part of the issue, and this obviously motivated us in many ways in creating the series, and for me in writing the book, is that in the long run, these are the biggest changes, right? If life expectancy, childhood goes from this incredibly dangerous period to being the safest period of your life. Many more people have a chance to live to 100 and meet their great-grandkids, right? These are momentous changes, but they happen incrementally. They aren't made out of events, right? And the news is so focused on events that, this happened today. And so all the focus goes to that kind of, day-by-day fluctuation, but that deep patterns don't get the coverage they need, right? That's part of the perceptual problem with this sort of phenomenon, right?
Yeah, I think that would be also an interesting book project. Like if you would go back for the last 200 years and you would just look at the newspapers, like how many of the really big changes that make up the story of your book would really be covered in the newspapers? Probably very few, right? Maybe some of the medical advances, because that's kind of an event sometimes, right? Like we've seen it now with the COVID pandemic. But many of these things probably wouldn't come up. Like, as you know, like one of the big changes that made much longer life expectancy possible is just better living conditions, economic growth, better housing conditions, just warm, not crowded places to live. Like that increase in prosperity happened over the last 250 years, at least here in the UK. And there was no headline ever that says the Industrial Revolution is happening, right? Like it was, in a way, it was like the biggest event of all of them, but it was an event that was never mentioned in any of the newspapers in these many years.
Yeah, and
not as a headline.
It is. I mean, one of the things I found fascinating is the first takeoff in life expectancy, and I want to get to defining life expectancy a little bit better in the next question, but there's this early takeoff among the British elite that happens around 1750 to 1800, 1850. And that seems to be one of the first points that we know where a significant group of people are living longer in a sustained way over time. But we didn't know that was even happening until some scholar kind of went through all the old parish records and and analyzed the data in the 1960s. So it happened. It was an experience that happened. It was meaningful, but it wasn't perceived by the people living through it. It took 200 years for somebody to even discover it. So hopefully that's changing now, because you and your team are compiling this data that other people are compiling. We have more feedback about what is happening in the world now than they did then, and that's presumably a good thing.
Yeah, that's really just one of the most extraordinary things, that some of the biggest things that happened in human history, just people that lived through it weren't aware of them. And your example is a good one of the British elites living longer, but even something like the last very major pandemic, I mean, now it's COVID. Basically, before the major one was maybe HIV/AIDS. That's still ongoing. But the last one a century ago, the Spanish flu epidemic, that was one that was hardly known by the people that lived through them. Right, just how much something as that has changed. That it would be hard to imagine that people live through COVID and aren't aware of it these days.
So let's turn to the actual category of life expectancy. Because it occurred to me, we made a whole show about it, but we don't completely define it, and it's an interesting statistical tool. It's a very powerful tool, right? Because it enables us to measure, and compare different societies at different times, different groups within a society. But explain to us how it actually works, because there's this interesting distinction between life expectancy at birth and life expectancy at other ages. So putting on your pure kind of statistician hat here and demographer hat, explain what is life expectancy?
Right. It's a very smart metric, and I think it's quite often misunderstood what it actually means. Like, I think what people often have in mind for life expectancy is that it tells us the average age at which people in a particular population die. And that is a measure that exists that's called cohort life expectancy. And for cohort life expectancy, you go back in time and you look at a birth cohort, a number of people in a country or so that were born in a particular year, and then you wait until everyone is dead and you look at the average length that all of those people lived. But of course, we can't have the cohort life expectancy anytime soon, because most people that were born anytime recently are still alive. And so
one would hope.
And so what statisticians do, they look at a different measure that's called period life expectancy. And that's looking at the mortality patterns, at the age-specific mortality pattern in one particular year, and then saying, what would be the average life length of a population that would live through the mortality patterns that are currently in this particular country, and if they would persist over their entire life course. And so it captures the mortality at a particular point in time rather than the mortality of a particular population. And that's important to understand, because it means that something like the COVID pandemic can have a very negative impact on period life expectancy for some short amount of time, but it can rebound afterwards. And that's because the mortality, like the age-specific mortality during that pandemic is much higher than before and after, and you see that as these big dips in the life expectancy charts during pandemics, and it bounces back right after.
The interesting thing about that, well, let's stay on that for 1 second, because I want to talk about life expectancy at different ages as well. But what's interesting about that to me is, if you think about the life expectancy of somebody born today, as you said, that if you're talking about period life expectancy, you're talking about based on the current state of mortality in, let's say, the United States right now, someone born today would be expected to live, whatever it is, 77 years or something like that, right? What that doesn't factor in is, yes, it might factor in the mortality from COVID right now, so the number would be a little bit lower than it had been a year ago. But it doesn't project forward in terms of any future advances. So it's basically someone born today and you say your life expectancy is 77, assuming there are no future improvements in human health over those subsequent 77 years. And so it does occur to me that there's almost like there's a third number you'd want to have, which is if average lifespans continue to improve at the rate they have in the society over the last 100 years, your life expectancy should be a higher number because they've been improving. Does that make some sense? Yeah,
that makes total sense. Like, yes, that's actually the answer. That's the statistic that people think that they're looking at often. Yeah. Even when they're not. Like, it's also important to emphasize that it's not some kind of like useless trick or something. Like, it's a useful statistic, right? The life expectancy tells you about mortality at one point in time, and that's important to know. And it captures that in this smart way of imagining this kind of synthetic population living through it. But yes, as you say, like, you would want to know, like, what can we expect for children that are born right now? Like, how long will they live? And in the past, it has been true that the difference between period life expectancy and cohort life expectancy, because that's what it is, has been around like 6 or 7 years or so. So
when you finally run the numbers on the cohort,
when they're all dead,
they end up living 6 years longer than they would have been projected at birth.
Yeah, like
Yeah,
of course that varies, right? Like when
yeah.
someone lives during a pandemic or something, but yeah, like 6 or 7 years, I think that's kind of like rule of thumb that maybe the demographers talk about when they are having the beer rather than in the academic conference.
Yeah. Well, that's what we're doing here. I think that's fascinating, and honestly, I didn't realize that number, that 6-year gap, had been computed, and now I'm thinking I'm going to have to add that to the paperback of the book. So this is good. There are still some things we haven't uncovered. So now let's talk about life expectancy at birth versus other ages, because this gets to the question that you and I have both received a lot. I mean, the number one skeptical response I have gotten to this project from the beginning and through the last month or so of it being out in the world is people saying, yeah, we didn't really double life expectancy. It's just that infant mortality dropped massively. And people aren't really, as long as you make it past, day 2 of your life, it's pretty much not that, we haven't really changed things. So explain why that's wrong.
Yeah, like firstly it's wrong, like let's get to that in a second, but it's also just, I find it just also not a helpful way of thinking about this statistic, because like saying that it's just because children don't die anymore, that's right. Like that's an odd use of the word just, right? Like that's really a major achievement, that parents don't see their baby die right after giving birth and like looking forward to having that child around, and like obviously the entire future of a child being taken away from them. Like that's in itself, I think, a major achievement, and in a way maybe it should actually like make us even more appreciate that achievement, because like what's more tragic than a child losing their life at a very young age, right? So I think that's a bit of an odd response that I often also get. But as you say, it's also not true. Like to some extent, life expectancy increased because mortality at a very young age decreased, but it's only a part of the explanation for these increasing life expectancies. And we see this if we look at life expectancy at particular ages. So before we were talking about life expectancy at birth, but there's no reason to not ask the question of like how long can a 5-year-old expect to live, or how long can a 20-year-old expect to live? And if we look at the numbers here for the UK, where often the long-term data is the best, then we know that before that takeoff in life expectancy at birth was around 40 years. And if we look at a 5-year-old, then we see that life expectancy in the mid-19th century was 55 years, so 15 years longer. And that increase of 15 years of life expectancy for the first 5 years that you survive in your own life, that shows that child mortality was a big reason why life expectancy was so low. But now if we look at life expectancy at older ages, say life expectancy for a 5-year-old, then we see that back then it was 55 years and now it's 83 years. So it's not just that life expectancy at birth increased, but it's life expectancy at all higher ages that increased, and that shows us that it's not just mortality at a very young age that decreased, but it's mortality across all ages that decreased. Up to very high ages, like if we look at 50-year-olds, for example, in the mid-19th century, the life expectancy for them was 71 years, so an extra 21 years, and now it's an extra 86 years.
Yeah, by the way, I should just mention, if people want to nerd out on all the different parameters of life expectancy, you have a wonderful, extensive page with many, many resources and many charts and timelines and maps even. At Our World in Data. I've spent a lot of time there, as you might imagine. But yeah, I was using the similar thing. I think you're looking at the same data. In 1850, something like for a 20-year-old, life expectancy was about 60, and now it's about 85. And I was making the point online the other day, kind of rebutting this criticism, which is to say, that's an extra that is a generation extra. That is a difference between meeting your grandkids and meeting your great-grandkids. And yes, there is this transformation of childhood, which I agree with you is a momentous achievement, but adding a whole extra generation of experience to your life is so extraordinary as well. And now, of course, a lot of the changes that are going to happen, if it continues to be extended, it's going to be at the older end of the spectrum, because we've made so much progress on the younger end. So and that's where you see more and more centenarians. My grandmother just died at 104, and that would have been really unusual 50 years ago, but there are actually a lot of people living into their hundreds out there.
That's also an interesting way of looking at it, at this, much of the gains now, as you say, were at these younger ages. And another way of looking at the same would be to think about it as the inequality of life length. The inequality of life length 200 years ago was extremely high. Basically you had people dying at all ages, from just right after birth until 80 years old. And what's happened now is that for most of the early decades, at least in rich countries, mortality is very low, and then people die in their 70s, 80s, and 90s. If you look at this as a curve, then you see the survival curve being very flat for the longest time, and then very steep, and the demographers call it the rectangularization of survival curves. It gets this rectangular shape rather than the...
That was the original title for Extra Life. It was weird, but it got vetoed. It's very catchy. So you bring up inequality. So this is another key thing I wanted to talk about that we touch on in the show, but it's such a key point, which is, you were just talking about inequality basically in a society, any random people compared to each other. But let's talk about inequalities between parts of the world, and to a certain extent, the great escape of life expectancy taking off was something that happened first in places like England and the United States, but that has come to the rest of the world, and what we're seeing now is a narrowing of the gap in health outcomes and life expectancy outcomes, and that to me is just, and I think to you, is every bit as exciting and thrilling to see as the overall average increase has been.
Yeah, that's also true. And the big picture there is that before the Great Escape, before this modern increase in life expectancy, inequality was low in the world, because no matter where you lived in the world, you only could expect to live relatively shortly. Nowhere in the world there was a country with a life expectancy over 40 years 200 years ago. And then you saw this widening of life expectancy over the following 150 years or so, where life expectancy in the richer countries improved very rapidly from the mid-19th century onwards. And then by 1950 or so, you had some countries that had basically made no progress since pre-modern times, and other countries that had already life expectancy over 70 or so. And now we see in the last 70 years that the biggest increases in life expectancy were in those countries that were worst off, maybe around 1950 or so. One number that really stands out is if you look at the country with the very highest life expectancy in 1950, that would be Norway, and they had a life expectancy of 72 years. Today, the life expectancy on average in the world is higher than the best of country back then in 1950.
It's amazing. It's really amazing to see. And you look at countries like India, where you had life expectancies 25 at various different points, and now it's around 70. Obviously tremendous progress in China, and post the kind of the end of the worst part of the AIDS epidemic in Africa, there's been a lot of progress in Africa as well. Is that right?
Yeah, that's right. Yeah, India is a really striking example where life expectancy doubled since the independence from the UK, from Britain. And yeah, the big decline, the most longer term decline was during the HIV/AIDS pandemic in Africa, where life expectancy was falling very strongly in many countries. Also particularly because it was a cause of death that hit people at a very young age. But now with more treatment becoming available in much of Africa and the death count of AIDS coming down, we see life expectancy rebounding in Africa. But it's still the case that life expectancy in Africa is much, much shorter than in much of the richer countries. So while the inequality has declined, it's still very large between the best of countries like Japan and the worst of countries that are mostly in the center of Africa, like Chad, the Central African Republic, Niger, that have life expectancies that are still under 55 years.
Well, and this is part of the point of this whole project, which is to say, by tracking this kind of progress, we also see what's left to be done, right? The work that has to continue to improve, and we can be encouraged by what we've done in the past in order to, and inspired to do more. So I could talk to you all day about this stuff. It's so interesting. But I want to cover one key thing before our time is up here, which is that the impact of mortality declines on population. So very quickly, we basically on the planet have roughly gone from 2 billion to a little less than 8 billion over this 100-year period that the show is particularly focused on. And people tend to, you always hear people like, people need to stop having so many babies, but it's not about people having more babies, people having fewer babies than ever per capita. It's that mortality has declined, children are living, grandparents are sticking around, and great-grandparents are sticking around, and the generations kind of stack up, and you end up with a population that grows from 2 to 8 billion in 100 years. So the population growth is really like a triumph of public health and rising living standards and all the things we talk about in the show. What does that mean then looking forward? There's a very important concept when we project out for the next 100 years of population growth that's known as the demographic transition, and you've written about this very well, and I think people just don't understand this concept. It's a really important one. Can you explain what this means and what its implications are?
Sure. So the demographic transition is one of these key models in demography that really allows us to make sense of the world. Like, it's kind of this question that you asked at the very beginning. And the basic idea of the demographic transition is that in the past, before modern improvements in health, population growth was very slow, and it was slow because mortality was very high. So fertility rates were very high. Women had on average 5, 6, or 7 children over the life course. And that would lead to rapid population growth unless most of these children die before they can become parents themselves. And that was basically the equilibrium, if you want to call it one, in pre-modern times. Very high birth rates counteracted by very high death rates. And then what we saw when countries improved their health is that the mortality rates first decline, but the birth rates still stay at that previously high level. And that's the period where you have very large families where people have 5, 6, 7 brothers and sisters that are all around them, like the many uncles, many cousins, kind of large families. That's really a temporary stage in demographic change. And that's the period where population growth is very rapid, where many survive to older ages, and there are many in the first place because the birth rates are still as high as in pre-modern times. But then we see in country after country that fertility rates come down and follow that decline of death rates. And in many countries in the world, they are now in some new equilibrium with low birth rates and low death rates. And once you have both of these key drivers of population growth, birth and deaths, at a low level, then population growth comes to an end. And the key insight of that is that very rapid population growth is a temporary phenomenon. That has been the case in many countries around the world, and the world as a whole is also undergoing such a demographic transition. And we know that it is during such a transition because the fertility rate in the world has already halved. 50 years ago, it was exactly twice as high as today. That's like some numbers that are easy to remember. 5 children per woman on average, and now it's just below 2.5 children per woman. And the growth rate of population growth has also halved from over 2% in the late 60s to a bit more than 1% now.
That's so fascinating. It's like this collective decision that keeps happening. I mean, it happened. Mm-hmm. It happened in Europe. It happened in England. You know, we went through this, demographic transition ourselves, and then it came to places like India, and that means basically based on the assumption that the demographic transition holds in the rest of the world, and mortality rates stay roughly where they are, that overall global population would stabilize at what number and when?
I think that's still a bit of a question, and it's it's an interesting one to discuss. So the UN population projection is that by the end of the century, population growth will just be above 0%, so we'll almost come to an end at the end of the century, and it will be at 11 billion, 10.9 billion by the end of the century. But it could be a bit higher than that, or it could be a bit lower than that. It could be higher if, for example, the cohort life expectancy of us is much higher than we expect. If it's not that 6 or 7 year gap, but who knows, maybe the two of us live until 150 or so, and if that happens to many, then that would of course mean that the population is higher by the end of the century. Who knows, maybe the two of us will still be around. And the other major driver is fertility, and particularly in Africa. In most of the countries in the world, fertility rates are very low and are getting close to 2 or often below 2 children per woman. In Africa, that's the region with the still highest fertility rates. And what we know from the demographic research is that it's particularly the rights and opportunities of women that is driving fertility. And basically, if Africa and the poorest regions within Africa develop very rapidly in the coming years and decades, if access to education is expanded rapidly, opportunities in economic terms are expanded, then we should expect population growth to be lower because fertility rates are lower.
So last question, building on what you just said. For a very long time, we have been on an increase in population track that has been concerning people since Malthus and before, right? The population globally keeps growing. And there's always been a sense of we have finite resources on this planet, we're going to run out, and we've not run out for the most part, which is a whole fascinating story. Now, for the first time, we have a projection that says we think actually that long-term growth in human populations that has been such a defining characteristic, particularly the last 200 years, that we think we see where that might top out and in fact start to decline. And so if we can make it work over the next 80 years, perhaps, whatever it is, the exact number, we will stabilize population and runaway population growth will no longer be a problem. How much of a difference would it make if we were able to push that outer boundary of the human lifespan, if we were capable of living to 150? Would that just create runaway growth forever, or would we eventually stabilize?
You would have to build a little model to really see the numbers, but what we can for sure think through is that it would nevertheless lead to a stabilization of population growth. If human lifespan is just extended, but still finite, if people still die, then that equilibrium point where population growth comes to an end would just be pushed out a couple of decades. So what really matters for an end of population is the ratio between births and deaths. And as long as people keep on dying at some point, then that ratio will at some point be 1 if births are coming down.
So the biggest problem is we don't want to have some radical breakthrough in fertility so that you could live for 150 years and also continually have children over that entire period.
Something like that.
That would really mess things up. All right, well, let's try and avoid doing that. Well, Max Roser, this was a wonderful way to end these conversations. As I said, you've been an advisor to this project from the beginning, and we've all benefited from your research, and also you're a wonderful writer about these ideas as well and making them coherent and intelligible. So thanks so much for joining us.
Thanks so much for having me, Stephen.
Thanks so much to Drs. Tara Smith and Max Roser for joining us for this week's final conversation. We're especially grateful to the CDC Foundation for their help putting these together, a nonprofit focused on saving and improving lives by strengthening public health protection through partnerships across the globe. Together, our impact is greater. And special thanks to Alex Dwyer for producing all these conversations. This is our final Extra Life conversation, but we hope you'll get a chance to see the entire series if you haven't already. It's now streaming at pbs.org and on the BBC iPlayer. In the meantime, there are links below where you can buy the book version or get education materials from the Pulitzer Center or learn more about the topics covered in this conversation. Thanks for joining us.